Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering NCLEX questions, NCLEX topics, guys, important things that you guys need to know for those big exams such as NCLEX, ATI, HESI, okay? I'm going to be going over, of course, the answers, but I'm also going to teach you how to eliminate the wrong answer choices. If you haven't done so already, please be sure to like and subscribe below. Go ahead and share my videos. If you have any friends that are classmates or new grads that are studying for these big exams, please be sure to share it. So first question. The nurse reinforces home care instructions to the parents of a child hospitalized with pertussis. The child is in the convalescent stage and is being prepared for discharge. Which statement by the parents indicate a need for further teaching? 1. We need to encourage fluid intake. 2. Coughing spells may be triggered by dust or smoke. 3. We need to maintain respiratory precautions in a quiet environment for at least 2 weeks. 4. Good hand washing techniques need to be instituted to prevent spreading the disease to others. And guys, if you feel like I'm going too fast, just go ahead and press that pause button, and that'll give you time to kind of look at the questions, think of what you think your answer is before I go over the answers and the rationales, okay? So the correct answer for this question is 3. We need to maintain respiratory precautions in a quiet environment for at least 2 weeks. Now, this question is asking us which one is wrong, and we know that because it says need for further teaching. Whenever you see need for further teaching, or what would the nurse question, or what would the nurse clarify, all of that is asking you which one is wrong. Okay, and the reason number 3 is wrong is because this child is in the convalescent stage. Okay, they don't need to be on respiratory precautions anymore. All right, they're not this. The pertussis is no longer communicable, so they don't have to be on the respiratory precautions. Everything else is correct. Yes, they need adequate fluid intake. Why? You want all those fluids to loosen up any mucus plugs or thick secretions that patient has, so you absolutely do want fluid intake. Coughing spells can be triggered by dust or smoke. Absolutely. A big teaching in peds that you teach those parents is that they need to make sure there aren't any dust mites around, and more importantly, they need to make sure that that child is not around any secondhand smoke, that they're not breathing in any secondhand smoke. And 3, good hand washing. Always, guys, you know good hand washing is good to prevent the spread of infection. Next question. A client enters the emergency department confused, twitching, and having seizures. His family states he was recently placed on corticosteroids for arthritis and was feeling better and exercising daily. Upon assessment, he has flushed skin, mucous membranes, an elevated temperature, and poor skin turgor. His serum sodium is 172. Which interventions would the healthcare provider likely prescribe? Select all that applies. And guys, if you guys watched my tips for passing NCLEX video, you'll remember that I told you whenever you have a select all that applies, you have to treat it as a true and false. You can't try to lump the choices together to make it right. You're going to go through each choice and see if it's true or false. If it's true, you're going to keep it. If it's false, you're going to throw it out, okay? So let's look at these choices. 1, monitor vital signs. Of course you want to monitor vital signs, absolutely. And one of the hints that we've been told in this is that this patient has elevated temperature, right? So absolutely we want to be checking their vital signs, which includes the temperature. 2, monitor intake and output. Absolutely. Why are you checking the INOs? Number 1, whenever you want to check a patient's status, their condition, right? The kidneys are the gatekeepers, okay? Once you see that output start to go down and you see that BUN and creatinine start to go up, you know that patient's in trouble. Why? Because when those kidneys shut down, the kidneys are trying to hold on to whatever it's got, because the kidneys like, whoa, I don't know what's going on, but I'm going to hold on to what I have. So the kidneys will completely shut down, and you're going to see the output go down and the BUN and creatinine go up. So we definitely want to check the INO. Where's the hint that lets us know to check the INO? Let's say you didn't know that. Guys, it says flushed skin, poor skin turgor. I'm worried about that patient being dehydrated. And you better believe if a patient's dehydrated, if those kidneys are functioning properly, they are going to start to shut down. You're going to see the urine output go down and BUN and creatinine go up. Also, another clue they gave us was that the sodium is 172. The normal sodium range is 135 to 145. Whenever you see hypernatremia, that's high sodium, very often what happens is that patient's going through dehydration, and that's why that sodium's so high, such as in this question. Number 3, increase water intake orally. Absolutely. Why? Because all of these things that are going on with the patient is letting us know this patient's going through dehydration. Okay, they were exercising all the time, sweating, they got flushed skin, dry mucous membranes, elevated temperature, poor skin turgor, and a sodium of 172. All of that screams dehydration. 4, monitor electrolyte levels. Absolutely. Why? Because that sodium is 172 and it's supposed to be 135 to 145. 5, put them on a sodium-reduced diet. Absolutely. Their sodium's already too high. Do we want it to be increased even more? No. Why do you think that patient's having the seizures? The sodium. Lastly, number 6, administer sodium replacement. No, this patient doesn't need more sodium. We need that sodium to go down. So number 6 is incorrect. Number 1 through 5 is correct. Next question. The nurse is monitoring a client receiving glipizide. Which outcome indicates an ineffective response to the medication? A, a decrease in polyuria. B, a decrease in polyphagia. C, a fasting plasma glucose of 100. D, a glycosylated hemoglobin level of 12. And I'll give you a moment to think of your answer. And the correct answer is 4, because this question is asking us which outcome is ineffective. That means bad. Which one is not working? And 4 is the correct answer. All of the other choices are good. So let's go over 4, then I'll go over the other choices. 4, hemoglobin A1c of 12. That's bad. That's absolutely bad, guys. So for diabetics, we want it to be less than 7. Patients who are not diabetic, we want it to be 5.7 or less, depending on your textbook. Some textbooks say 5.6, but in that area. But if it's 12, whoa, that glucose is not being controlled. So that med's not being effective, right? Let's look at our other choices. You have 1, a decrease in polyphagia. Well, that's good. That med's working. A decrease in polyuria. That is good. Fasting plasma glucose of 100. That is good. Fasting plasma glucose, we wanted between 70 and 110, so that's perfect, okay? So 1, 2, and 3, let's just know that that medication's being effective, okay? And 4, hemoglobin A1c of 12, absolutely not. That lets us know that this medication's either not being effective or the patient's not compliant. They're not taking their medication and eating the way they should be doing so. Okay, next question. A post-op client requires medication for flatulence, gas pains. Which medication from the following PRN list should the nurse administer to the client? 1, ondansetron. 2, simethicone. 3, acetaminophen. Or 4, magnesium hydroxide. And guys, the correct answer for this is simethicone. And you guys will hardly ever get a question like this where it's just direct. It really doesn't require critical thinking. Either you know it or you don't. But this happens to be one of them. So that is what you're going to give for gas pain. So let's look at our other choices. 1, your Zofran. Zofran's given for nausea. If the patient has nausea and vomiting, we're going to give them Zofran. 3, Tylenol. Well, Tylenol is an analgesic. okay? And sometimes it's used as an antipyretic to bring down the temperature. Then you have 4, magnesium hydroxide, which is a milk of magnesia. Guys, that's used as a laxative. Sometimes it's used as an antacid, but definitely not for gas pain. Next question. A client's admitted to the hospital with a diagnosis of major depression. During the admission interview, the nurse determines that a major concern is the client's altered nutrition related to poor nutritional intake. Which nursing intervention related to altered nutrition should be the initial choice? 1, weigh the client 3 times per week before breakfast. 2, explain to the client the importance of a good nutritional intake. 3, report the nutritional concern to the psychiatrist and obtain a nutritional consult as soon as possible. Or 4, offer the client several small, frequent meals daily and schedule brief nursing interactions with the client during those times. And I'll give you a moment to think of your answer. So client. All right, guys, so the correct answer is 4, and I'm going to explain to you why. This client has major depression, and I explained this in my video I did on psych. I know I owe you guys another psych video. You'll have one coming soon. But when a patient has major depression, they have anger and hostility and resentment turned towards themselves. I suck. I'm so horrible. My life is horrible. I can't do anything wrong. All of that anger and resentment, it goes inside. They turn it towards themselves. That's what the major depression is, okay? So this client's not eating. We're worried about them. All the other choices, 1, 2, and 3, those are great options. We're going to do that. But initially, the first thing we want to do, get food in their stomach. Okay, remember physiologic integrity and nutrition's one of them. If you guys go back to my video I did on the 11 tips to pass NCLEX, I went over Maslow's hierarchy of needs and what it really means, how important it is, okay? Physiologic integrity, what's keeping that patient alive is going to be your priority. And nutrition is on that list. So what are you going to do? You're going to offer them small, frequent meals, right? But not only are you going to offer them those meals, you're going to make sure that you schedule time to go sit with them and visit with them. Why? Because remember, the anger, the aggression, the hostility is turned towards themselves. They feel like they're not worthy of any attention. They feel like they're not worthy of any social interaction. So as a nurse, when you take that time to sit with the patient, even if you don't say a word, but you just sit right there next to them, you're giving them value. You're letting them know that they are worthy. They are important. So while you're sitting there, you can say, Mr. Such and Such, you know, this is a beautiful lunch tray. Why don't you take a couple bites? Okay, so you're really killing 2 birds with 1 stone. Number 1, you're making sure he gets the nutrition. And then number 2, you're also helping with that psychological aspect by letting that patient know that they are worthy of your time. All right. Next question. A client received 20 units of NPH insulin sub-Q at 8 a.m. The nurse should check the client for potential hypoglycemic reaction at what time? 1, 5 p.m., 2, 10 a.m., 3, 11 a.m., 4, 11 p.m. And I'll give you a moment to think of your answer. Guys, this is a famous question that they love putting on NCLEX. Of course, these are not the choices, but this is the type of question when it comes to insulin they love to do, okay? So this patient just got 20 units of NPH at 8 a.m. When are you going to check for a potential hypoglycemic reaction? And the correct answer is number 1, 5 p.m. Why? 5 p.m. is the peak time of that NPH. That's when we expect that NPH to peak. So I want to bring something to your attention because you guys would not understand this unless you know the peak time of the insulin. So you have your, when we're talking about the intermediate action, oh my gosh, guys, I cannot speak today. You have your intermediate acting insulin, your NPH. So the onset is 1 to 2.5 hours, all right? So let me explain to you what onset means. When someone's asking you what the onset means, and for the NPH, like I said, for NPH it's 1 to 2.5 hours. If you are being asked about the onset, what you're really being asked about is when you're going to make sure that patient eats. When you're going to make sure that they have that food tray in front of them. Because that onset is when that insulin starts working. And that onset is when the insulin's going to make that patient's blood sugar go down. So the onset is when you expect to have that tray in front of that patient for them to start eating, okay? The next one is your peak. The peak for NPH is 4 to 12 hours. When you expect to see the peak of insulin, all right, peak is high, right? So the peak of that drug, of that medication insulin, is when the patient's blood glucose is going to be the lowest. That is the time that that patient's most likely to bottom out on you, to pass out, right? And I taught you in my diabetes video that hypoglycemia is way worse, way more dangerous than hyperglycemia. So whenever you're being asked about a peak of insulin, that's really when the patient's blood glucose is going to be the lowest. So that's when you really need to be checking their blood glucose to make sure that patient doesn't bottom out. And then of course you have your onset, you have your duration. For NPH, that duration, that's about 24 hours. That's how long it's lasting for in that patient. Okay, so that's why for this question, the correct answer is 5 p.m. because we know if that patient got that NPH at 8 a.m. and we know that that peak is between 4 to 12 hours, we're expecting to recheck that patient and watch out for the hypoglycemic reaction around 5 p.m. because that's a peak time of the insulin. Next question. The nurse assists in developing a plan of care for a client with hyperparathyroidism receiving calcitonin. Which outcome has the highest priority regarding this medication? 1, relief of pain. 2, absence of side effects. 3, reaching normal serum calcium levels. Or 4, verbalization of appropriate medication knowledge. And I'll give you a moment to think of your answer. Okay, guys, the correct answer is 3. So let me explain this to you. Patient has hyperparathyroidism, right? So you have your thyroid gland sitting right here, and then those 4 dots on your thyroid gland are your parathyroids. And whenever you see parathyroids, you're thinking about calcium in the blood. Not the bone, the blood. Whenever we're talking about the parathyroids, we're concerned about calcium in the blood. So if the patient has hyperparathyroidism, what do you think they have a lot of in the blood? Calcium. Hyperparathyroidism, hypercalcemia. Hypoparathyroidism would be hypocalcemia. Okay, so the parathyroid relates to the calcium that's in the blood. So this patient has hyperparathyroidism, which means they have hypercalcemia, a lot of calcium in the blood. Now they're taking calcitonin. What does calcitonin do? Calcitonin decreases the calcium that's in the blood because the patient has too much calcium in the blood. So a priority action to do is to look at the the calcium levels and make sure that they reach normal, because the whole reason that patient's getting calcitonin is to bring that calcium level back to normal, okay? Your calcium level is 8.5 to 10.2. Some books say 10.3 or 10.1, and that's fine. Whatever your textbook says, go by that. You can be off by that 1 or 2 points. That's fine. Calcium is not one of those electrolytes that have the therapeutic range. So your calcium's 8.5 to 10.2. That patient's taking calcitonin. You're going to be constantly checking that calcium level. Why? You want that patient to reach a normal calcium level. So that's going to be your highest priority. Let me go over the other choices. 1, Relief of pain? No, that's just wrong. 2, absence of side effect. Yes, that is something you're going to watch out for. Whenever you give a med, you're always going to watch out for side effects, but that's not going to be the priority of this medication, right? Yes, you're watching out for side effects, but the priority of the medication is to see if this medication is working correctly and getting that patient to the normal level. 4, verbalization of appropriate medical knowledge. I talked about this in my NCLEX prep video. Teaching and knowledge, very important, but that's not part of physiological integrity. That's not going to keep that patient alive. That's not going to be a priority, okay? Especially not in this situation where we actually have number 3. Next question. The nursing instructor asked a nursing student about the cause of hemophilia. The student correctly responds by telling the instructor which fact about hemophilia. 1, hemophilia is a Y-linked hereditary disorder. 2, a splenectomy resolves the bleeding disorders. 3, hemophilia A results from a deficiency of the factor VIII. Or 4, a bone marrow transplant is the treatment of choice. And I'll give you a moment to think of your answer. And the correct answer is 3. Hemophilia A is from not having enough of that factor VIII, okay? That factor VIII is your clotting factor that helps you clot so you don't bleed out. So those patients who have hemophilia A, they don't have that factor A, which means they don't have those clotting capabilities, which means they're what? Bleeding all over the place, and you know the chance of them hemorrhaging to death is very high. Let's look at our other choices. It says 1, hemophilia is a Y-linked hereditary disorder. No, it's X, okay? X chromosome. 2, a splenectomy resolves the bleeding disorder. That's wrong. There is no cure for the hemophilia. There's treatments, constant treatment, but no cure. And number 4, bone marrow transplant is a treatment of choice. That's wrong as well. So the correct answer is 3. Next question. A 4-year-old child is admitted to the hospital with suspected acute lymphocytic leukemia. The nurse understands that which diagnostic study should confirm this diagnosis? 1, a platelet count. 2, a lumbar puncture. 3, bone marrow biopsy. Or 4, WBC count. Now I'll give you a moment to think of your answer. All right, guys, so the correct answer is 3. The confirmatory test for ALL, which is your acute lymphocytic leukemia, is the bone biopsy, which, by the way, guys, is extremely painful. It is extremely painful. So what they do is take a needle and insert it all the way into the bone, get some of that bone marrow, and they test it, and that's how they confirm that that patient has ALL. All the other choices are incorrect. Next question. To ensure a safe environment for a child admitted to the hospital for a craniotomy to remove a brain tumor, the nurse should include which in the plan of care? 1, initiating seizure precautions. 2, using a wheelchair for out-of-bed activities. 3, assisting the child with ambulation at all times. 4, avoiding contact with other children on the nursing unit. And the correct answer, guys, is 1, initiating seizure precautions. That's going to take priority over everything else. I want you to think about it. This kid's got a tumor in the brain. They're about to get surgery in the brain. So you want to make sure that they don't get seizures, because seizure is abnormal firing of neurons where? In the brain. Duh. It makes sense, guys. So you're going to put that child on seizure precautions. You're going to make sure that that bed is in the lowest position. You're going to make sure that the side rails are up. You're going to make sure that the side rails are padded. You're going to make sure that you have a mat on the floor. You're going to make sure that the lights in the room are dimly lit. Why? Because when you're putting patients on seizure precautions, you want to decrease the stimulation. You're going to make sure that that patient is all the way at the end of the hall, not near the nurse's station where the nurses are talking, getting report, where the doctors are giving orders, where the phones are going off, the fax machines. No, you want them at the end of the hall where it's nice and quiet. You're going to put them in a room by themselves, and if they have to be in a room with somebody, it's going to be someone, that has a condition where they'll hardly be talking, such as a patient that has hypothyroidism, right? All of those seizure precautions that you guys learned back in fundamentals of nursing, you got to bring it back to the forefront of your mind. So this patient that's having brain surgery, that's most important, the seizure precautions. Let's look at our other choices here, guys. And by the way, seizure precautions, it's all about what? Safety. We want to make sure that if they have a seizure, they don't bang their head against the side rail and hurt themselves. That if they have a seizure, they don't fall to the ground and hurt themselves or bang their head against the ground, right? Look at our other choices. Using a wheelchair for out-of-bed activities. Why would this patient need a wheelchair? They're getting surgery for a tumor in their brain, right? And even if they did need a wheelchair, guess what? The seizure precautions will still take precedence. Choice 3, assisting the child with ambulation at all times. Again, that's not necessary. And even if it was, seizure precautions still would come first. And then 4, avoiding contact with other children on the nursing unit. That's not necessary. Matter of fact, unless the child has an infection, you actually want to promote socialization with other children because that's important for their growth and development. Next question. The nurse is preparing to suction an adult client through the client's tracheostomy tube. Which intervention should the nurse perform for this procedure? Select all that applies. Remember, guys, we're going to treat our select all that applies as true or false. Number 1, apply suction for up to 10 to 15 seconds. True, absolutely. Matter of fact, most textbooks say 10 seconds. Some do say up to 15, so you go by what your textbook says. But for testing purposes, I promise you guys, NCLEX, ATI, HESI, they're not that evil. They're not going to make it close. They're going to give you a big number where it's way out of a range where you either know it or you don't. So absolutely, you want to suction for up to 10 to 15 seconds. 2, hyperoxygenate the client before suctioning. Absolutely. Every time you suction a client, you want to know what you're taking away from them? Oxygen. Yes, you're suctioning to get rid of the mucus plugs, but at the same time, you're taking away oxygen. So before you suction that patient, you're going to hyperoxygenate them. You're going to give them You're going to give them oxygen. Then you're going to go in. By the way, guys, you don't suction going in. You suction coming out. So you're going to hyperoxygenate the client. You're going to go in, suction off. Then as you're pulling out, you're going to be suctioning for only 10 to 15 seconds. And guess what, guys? You're doing a circular motion. It's going to be intermittent. Okay? So 2 is correct. Number 3, set the wall suction unit pressure at 160. That's absolutely incorrect. All right, the range for it is 80 to 120. 160 is way too high. Choice 4, apply suction gently while inserting the catheter. Well, I already answered that question for you. You never suction going in while you're inserting. You only suction while you're coming out. Number 5, apply intermittent suction while rotating and withdrawing the catheter. Absolutely. I just showed you how you do it. When you're coming out, you're going to be doing in a rotating manner, right? And also it's going to be intermittent. So your finger is going to keep tapping on it, the suction as you're coming out and in a rotating fashion. So absolutely. And number 6, you're going to advance the catheter until resistance is met and then pull the catheter back 1 centimeter. Absolutely. When you're going in, you're going to insert until you feel resistance. When you feel that resistance, you're going to pull back just about 1 centimeter. Then you're going to start the suctioning, rotating manner, going out, and you're only going to do it for up to 10 to 15 seconds, okay? And that's the answer for that. Select all that applies. So, guys, I hope this video was helpful to you. I'm asking you to please support this channel by subscribing below and also sharing my videos. I'm sorry, I can't speak today. But to support this video, you guys subscribe, you share, and please in the comments let me know what videos you'd like to see me do, what topics you'd like to see me cover. Guys, I appreciate the time that you spent with me. Thank you so much, and I'll see you next time.